Hey everyone, it's Anastasia, Anastasia's Hump Day Happenings. Last year, I did a video on stroke recovery. It was basically on dental care. I'm gonna switch it up a little bit because this hits home for me. It is National Stroke Awareness Month. My grandfather had suffered one. My dad suffered minor ones. A couple of things to pay attention to. The first thing to recognize is emotional wellness. That means recognize the symptoms, be aware, be present. Are you going through signs of depression or anxiety? And this could be seen in the caregiver or the person who's recovering from stroke. Now, in all of the other doctor's appointments you'll be keeping, a behavioral therapist or a cognitive therapist may be one. It is about your emotional health. So that's where we want to get you, because this is a process for both caregiver and the individual. Second, of course I know dentistry is not going to be on your priority list. Let's face it though, some individuals, I would say the majority who are susceptible or at risk for a stroke, may have investments like you're managing gum disease, you have dental implants or bridges in your mouth that need maintenance. The health of your mouth, the pH of your mouth is very important because you have to eat. You have to keep your body healthy because you need the energy, you need the strength to go to physical therapy, speech therapy, occupational therapy, and understand nutrition. Yes, I recognize that dentistry is last on your list, but let's get to the recovery portion of where you both can help each other out, caregiver and individual. Whatever you read, they're gonna say, brush, floss, mouth rinse. Reality check, brushing. You may have facial paralysis and you may lose sensation on the side the stroke was. So therefore food or drool or saliva, it may come out and you're not aware of it. Your dexterity may be weaker. In saying that, how are you supposed to swish? That's not going to happen. What you can do is make sure that your teeth are brushed. Oral hygiene regimen is very important. So, toothbrush, it may not be your regular one. Maybe you need an electric toothbrush. What I can share with you is you're definitely going to need a wider handle, and I would recommend, instead of an adult soft toothbrush, I would recommend a child or a youth toothbrush so you can get further back and be able to make sure you disturb the bacteria. The next thing, toothpaste. Personally, I would recommend that it's got fluoride in it, and if you want to go through a prescription route, yes, it's about being healthy and staving off the bacteria, keeping your enamel strong, tooth decay at bay, and inflammation at a lower level. And that way we can get you healthy when the time is right for you to come in. Flossing, did we not just talk about dexterity? I don't know where these people get this. So dexterity, yes, you could be able to get an interdental pick in between your teeth. You may need help with that. What I would recommend is caregiver, please just ask what they're comfortable with and maybe help them with that interdental pick. I'll show you a couple of links on this. I would say get a finger, like an indexed baby wipe that's got xylitol in it, and make sure you swoop out the food in the vestibule of your mouth. The vestibule is the space. Here, sweep it out and then place it into a tissue and toss it in the trash. Very important, and especially with xylitol. Xylitol is an amazing ingredient. The next thing I would do is have a spray, instead of a mouth rinse, a spray. Lubricity, Spry, I'll include those links. These are great products to have because you cannot swish or rinse. It will help you with chewing. We need to stimulate your saliva or help food pass easier down to your throat so you can fuel your body. Super important. If you're already managing gum disease, let me just share this. Pathogens from gum disease and gingivitis, they'll cluster together. And in stroke individuals, they have found if you swallow that, it is possible that you could aspirate that. It's aspiration pneumonia. Nobody needs that. I share this, it's so important to understand that the path to recovery, you're on it. This is a great thing, you're on it. But please, it takes the help and assistance of everybody, and you've got to feel your body and make sure that your mouth is fit to go through this process. Caregiver, keep up your health and wellness appointments with your dental hygienist. The individual recovering from the stroke, I would say in and around 6 months, but please make sure that you do ask your dentist. Now you got a question for me, ask it. Otherwise, like this channel and join me every single week. And until next Wednesday, take what you learn and make a difference with it.